Good evening to one all present here. I welcome you all to Pagnavaridhi lecture series conducted for second year BMS. Before which I would like to give a small introduction about our organization Panchajanya. Panchajanya, the divine count of Bhagavan Sri Krishna, which was blown during Kurukshetra, indicating the start of Dharma Yuddha that followed. All the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motive. Keeping the same motive in our organization will work towards establishing the importance and necessity of following and imbibing Bharatiya culture, accepting our roots, and making people realize the true essence of Ayurveda, not only as a treatment modality but also as a way of life. All this while walking in the path of Dharma. Hence the motto Shreyam Bharatiyam Arogyam Ayurvediyam. With this aim in mind, I would like to welcome you all to Pagnavaridhi lecture series conducted for second year students. Today we have with us Vaidya Helen G. Monica ma'am. Ma'am is currently working as an assistant professor in Roganidana department in Parul Institute of Ayurveda and Research. Ma'am completed her UG from Government Ayurveda College, Nagarkoil. PG from Alvas Ayurveda Medical College, Moodbidre, Bangalore. Ma'am has a total teaching experience of 4 years. Ma'am has done a PG dissertation on the topic, an observational study to evaluate the role of Asatmyaja Nidana in Tamaka Shwasa. Ma'am has attended various national and international conferences and published 3 research projects. We are very honored to have you in the session, ma'am. Handing over the session to you.
Thank you so much for your warm welcome. So today we will be seeing an exam-oriented overview on the topics like Khalitya, Palithya, Shleepada and tuberculosis. So it will be totally exam-oriented for the exam-going batch, second year senior batch students. Okay, so I will be moving into the topic. So myself, as she introduced, Dr. Helen Monica. I am working as assistant professor in Parul Institute of Ayurveda and Research. So we will move into the topic. I'm audible, right?
Yes, ma'am.
Okay. So you all know now we have the syllabus change, right? So here the topic Palithya comes under the domain CC. CC is nothing but cognitive and comprehension. And under the Miller, it is come under NK. That is nice to know. So we are not going to get any 10-mark questions or 5-mark questions in Khalitya and Palithya. We will be getting only MCQs. Okay, so MCQs questions we will get under Khalitya and Palithya. And in Miller's 2, M2, it is mentioned that it is KH, that is knows how. We should know what is Khalitya, what is Palithya, just MCQ questions on that basis we have to study. And under the topic Shleepada, okay, Nidana and Samprapti of Shleepada, enlist the Veda of Shleepada, enlist features of Shleepada. These three also they are considered under NK. That is nice to know. Okay, so you won't be getting any 10-mark or 5-mark questions under Shleepada. You have to study. You should know what is it. Know and knows how it comes under Miller's, right? So they are telling you should just know and you should understand the concept. You should be sensitized to the topic of Shleepada. Okay, so basic knowledge you should have. And again, coming to the tuberculosis. Okay, tuberculosis, they are telling the clinical presentation of tuberculosis. They are telling it is coming under DK, that is desirable to know. You will be getting MCQs and 5-mark questions under tuberculosis. Okay, and here also 2 practical session knowledge questions are there in syllabus, like perform relevant clinical examination of tuberculosis. So in a lab or in other hospital side, you can just go and do, or you can see how they are doing the clinical examination for tuberculosis. What is Montax test? So it is a practical oriented topic. Okay, this CO3 course outcome is CO3, and next one is the investigation. Order and interpret the relevant investigation of clinical presentation of tuberculosis. Okay, so it is also coming under cognitive application. Okay, that is a DK, desirable to know. You have to know this. And shows how. Shows how is nothing but you have to perform. It should be shown to you how to do that, and you also should do it, and you should be sensitized how to do the investigation. Okay, so these are the topics which we are going to cover here. So here most of the topic which we are going to see, as I told, these topics are not coming under 10 marks. None of the topics which I am going to take comes under 10 mark. Only tuberculosis will come for 5 mark, and the remaining all the topics will come for MCQs. So here I had come with the 30 MCQs. Okay. So with the MCQs, I'm going to explain the topic as well. Okay. So we will go one by one. The first MCQ which I had prepared is from Khalitya Palithya. The question is, in telogen effluvium, thinning of hair is the main feature caused due to the option A is insect bite, option B is psychological distress, option C is aging, and option D is none of these. Okay. So telogen effluvium is the thinning of the hair. Okay, thinning of the hair, and the hair will fall off, and mostly it is a temporary condition. Okay, temporary condition. And they had asked about the main feature. Okay, what is the main cause? So the main cause is, the answer is the psychological distress. Okay, so coming to the answer. Okay, answer. The common causes may be acute illness, any fever, cold, okay, or any viral infections, any infection, acute illness, chronic illness, okay, hormonal changes, okay, like in PCOD or endometriosis or uterine fibroid, okay, or hypothyroidism. Any hormonal changes will affect your growth of the hair also. And medications, medications mainly the medications like what are birth control pills, okay, taking too much of antibiotics, okay, taking too much of painkillers will also will affect the growth of your hair. Diet, okay, having the diet, improper diet where the sufficient nutrients are not provided to the body, which will cause deficiency, okay, will also affect the growth of your hair. Psychological stress, I told you, right, here in answer is psychological distress. So psychological stress will also will hamper the growth of the hair. Okay, then heavy metal ingestion. Okay, so any through medicines or through any products, if any heavy metal injection is there, if we are accidentally taking heavy metals, it will also affect the growth of the hair. Thyroid dysfunction, I told, right, hyperthyroidism, hypothyroidism, both will cause thinning of the hair and hair fall. And deficiencies mainly like vitamin B12 deficiency, iron deficiency, will also cause the telogen effluvium. Okay, telogen effluvium is thinning of the hair. So here you can see the um, options like insect bite, if I psychological distress, aging, and the option D is none of these. So the correct answer will be psychological distress. It is the major causative factor for telogen effluvium. Okay. So moving on to the next second question. The second question is, what alopecia areata is dash related. So what is alopecia areata? Alopecia areata is nothing but a falling of the hair in circular patches. Okay. In Ayurveda, we used to tell the term as Indraluktam. Okay. So alopecia areata is caused due to what? Option A is autoimmune. Option B is hormonal changes. Option C is medication. Option D is metabolic stress. Okay. So the correct answer will be alopecia areata is nothing but Indralukta, where there will be circular patches of hair fall. Okay. So the answer is what? Autoimmune. Okay. So alopecia areata can be caused due to genetic factors. So mainly the variation of the HLA-B27 gene. Okay. HLA, that is human leukocyte antigen B27. When there is variation, mostly it is proved, many researchers have done and proved that most of the patients who have alopecia areata is having variation with the HLA-B27. Okay, and then family history. If family-wise, genetically, if the parents and grandparents, everyone are developing this baldness, sorry, alopecia areata is there. Then this one, the progeny is also very, uh, they are prone to get this disease. And environmental factors. Okay. So taking any environmental factors, maybe climate change, or if there is any change in the climate which is not suitable, incompatible to the body of that patient or person, can also cause alopecia areata. And taking birth control pills, taking beta blockers. Okay, beta blockers will be taken in case of hypertension, right? Retinoids. Retinoid is nothing but a compound of vitamin A. Okay, we used to tell us retinol. Nowadays, many are taking in terms of what, for reducing the aging, right? So, if it is taken in an improper way, also will lead to alopecia areata. And autoimmune disease like lupus, okay, then vitiligo, then atopic dermatitis will also cause as a complementary for the disease, it will cause alopecia areata. Okay, so alopecia areata is mainly not due to hormonal change, it is not mainly due to a metabolic stress or medication. The major cause is autoimmune. It is due to the variation in the gene HLA-B27, and the another one major reason is it is autoimmune disease. Okay. Moving on to the third question in Khalitya Palithya. The third question is causes of Kesha Patana. Pick the odd one out. Okay. Causes of Kesha Patana. What is Kesha Patana? Falling of hair from the scalp. So, what may be the causes? So, here four causes are given down in subdivisions. In that, one is the odd one is the wrong one. Which one we have to find it out. So, the option A is Shara Ati Prayoga, Upayoga. Option B is Krimi. Option C is Asti Majja Dhatuvagni Vikara imbalance. Option D is Mamsa Ati Upayoga. Okay. So now itself you can come to a conclusion. You will get one idea which will be the answer. Yes, the answer is the Mamsa Ati Upayogam. Actually having Mamsa, okay, like good fat. Because Mamsa is having like fish meat or red meat is having omega-3 fatty acids, right? So they are good for your actually hair. They are a good source of protein, they are good source of iron, right? It is good for your hair. So the Mamsati Upayoga is the odd one. Okay. The remaining three are the right answers. Okay. So we will come to the explanation of the answer. So what will happen? Ikesha Patana, why the hair is falling out? According to Ayurveda, Acharya says that in the scalp, okay, when pitta dosha gets aggravated in the hair follicles, the hair will fall out. Okay, and they also says that shara ati upayoga. What is shara ati upayoga? Shara, if the person is taking too much of salt, or the person is taking too much of alkalis in terms of medication, okay, taking too much for the body will also cause the hair fall. Okay. Then krimi. Krimi chapter you might have studied about the types of krimi. Bahya krimi, okay, Raktaja krimi, Shleshmaja krimi, right? Purushaja krimi. There are types of krimis. In the Raktaja krimi, there are two types like Keshada and Lomada. Okay, these two krimis are more prone to cause what? Falling of hair. So they are also a reason for Keshapatana. Romada and Keshada krimis, which comes under Raktaja category or causes for Keshapatana. And the third one is Asti Majja Dhatuvagni Vikara imbalance. Okay, so you know the Dhatuvagnis you have already studied. Okay, so in that Asti Majja Dhatuvagni, okay, because their Upadhatu is Kesha, right? So if there is any imbalance in the Dhatuvagni of Asti and Majja, will also cause Kesha Patanam. Understood? So here the first three are the right answer, and the wrong answer, the odd one, is the Mamsati Upayoga. Got the point? Am I audible? Am I audible?
Yes, ma'am.
Okay. So the fourth MCQs which I want to share you is in Khalitya, the scalp gets thickened due to the involvement of option A is Shonita plus Vada. The option B is Shonita in combination of Pitta. Option C is Shonita in combination of Kapha. And option D, none of the above. Okay. So in Khalitya, okay, in Khalitya, what will happen? Baldness will be there, right? So there the scalp, the hair won't be growing properly. Okay, the hair fall will be there and new hair follicles is not formed. The hair is not growing from the scalp follicles. Okay, so what may be the reason? So what combination? Vada and Rakta or Pitta and Rakta or Kapha and Rakta? Which is the reason or none of the above is the question asked here. So the right answer is what? Shonita and Kapha. Okay, so thickening is there. The scalp is getting thickened. The Romakupa is getting blocked. Okay, so the blockage is caused by Shonita and Kapha. It will go and fill the Romakupa, that is the hair follicles. The hair follicles, when it is filled with Shonita and Kapha, what will happen? It will be totally blocked. Due to the nature of kapha, what will happen? That area will get thickened. So what will happen? The formation of new hairs won't be possible. Okay, got the point? So in Khalitya, the scalp will be thickened due to the involvement of Shonita and kapha. Okay. And the fifth question is, which is the longest phase in the cycle of hair follicles? There are four phases in hair cycle: anagen, catagen, telogen, and exogen. So they are asking which is the longest phase. Okay, so coming to the answer, the longest phase is the anagen phase. Okay, so I will explain you what is anagen, what is catagen, what is telogen, and what is exogen. Okay, so anagen is the first phase, that is the growth phase. It will take around 3 to 5 years. That's why we tell it is the longest phase. Okay, it will take 3 to 5 years. In this phase only the hair will grow. Okay, next comes the catagen phase. It is the transition phase. Okay, transition phase means what? It is going to transfer from one phase to another phase. So from growth phase it is going to the resting phase. So that in between that phase is called as the catagen phase, and it will be around 10 days. What will happen in this phase? The hair follicles will shrink and the growth will slow down. Okay, in the growing phase the hair follicles will be widened up. It is giving the room for the hair to grow. But in the catagen phase the hair follicles will shrink. Okay. Next comes the telogen phase. This will be around 2 to 5 months. Okay. And in this, what will happen is the hair will be totally in resting phase. There won't be any growth. There won't be any shedding of hair. Totally, the hair will be in the resting phase in the telogen phase. And the last phase is the exogen phase. It is also taking around 2 to 5 months where the hair is totally shed down. The old hairs will be shed down. And in this phase, we no need to worry, we no need to panic, because we should understand that the old hair is shedding down to give the space, room for the new hairs to grow. So it is actually a good thing. Okay, so during the exogen phase, everyone will be facing the exogen phase, right? We will have a sudden hair fall, but don't to worry. In 2 months, it will be solved. It will be coming down. It will be reduced, and no need to worry. No need to worry that there won't be any hair in the scalp, because When the hair fall, immediately the hair follicles, from the hair follicles, new hair growth is started. Okay, so four phases are there: anagen phase, catagen phase, telogen phase, exogen phase. Anagen phase is growth phase, catagen phase is transition phase, telogen phase is resting phase, and exogen is shedding phase. So anagen phase is the longest phase which takes around 3 to 5 years. Okay. Moving on to the next question, duration of exogen phase. So already I explained to you in the last slide about each phase and the time it takes. So anagen phase we saw 2 to 5 years, right? And next one is the catagen phase, 10 days. And telogen and exogen phase is 2 to 5 months. So here from the what subdivisions given down the answer, we can come to a conclusion that the option C, 2 to 5 months, is the right answer. Okay, so exogen phase is the extension of telogen phase, and exogen phase lasts for 2 to 5 months. Okay, coming to the seventh question, complete hair loss from the scalp region is termed as. Okay, complete hair loss from the scalp region is termed as. Option A is alopecia areata, option B is alopecia totalis, option C is alopecia universalis, and option D is all of these. Okay, so what may be the answer? The option B is the answer, that is alopecia totalis. Okay, so you have to understood first what is alopecia areata, what is alopecia totalis, alopecia universalis. Okay, I will tell you alopecia areata is nothing but the indralupta, that is patchy hair loss in the scalp is alopecia areata. Alopecia totalis is nothing but total loss of hair from the scalp, only from the scalp region. Totalis is only from the scalp region. Alopecia universalis is the entire body. All over body we have hairs, right? In our hand, in our legs, in the pubic region, right? We have hairs in the armpit, right? We have hairs. So eyebrows, eyelash, right? So all over the body we have minute hairs, right? So in univalis, what will happen is the complete hair loss over the entire parts of the body will be seen. So that you have to keep in mind. So there are three terms alopecia. Under alopecia, there are three terms: alopecia areata, alopecia totalis, alopecia universalis. Alopecia areata is patchy hair loss. Alopecia totalis is total loss of hair from the scalp. Alopecia universalis is total loss of hair from entire body. Okay, so here question is hair loss from the scalp. So the correct term is alopecia totalis. Got the point? The next one is Rujya is the synonym for which one? Option A, Khalitya. Option B, Palithya. Option C, Indralupta. Option D, none of the above. So the correct term is what? Rujya is the synonym for Indralupta. Okay, Rujya is the term for Indralupta. This you have to remember. It is a very important MCQ question you may get. Okay. Coming to the ninth question, the excess of dash lead to the pachana of doshas in the hair root in Palithya. Okay, what will cause which dosha or which guna? Okay, which guna will cause the pachana of doshas in the hair root in the Romakupa? Option A Shita, option B Ushna, option C Ruksha, option D Slakshna. So from the word Pachana of doshas only we will get one idea which will be the answer. Yes, the answer is B, that is Ushna. Okay. So you know very well that Palithya. What is Palithya? Palithya is nothing but graying of hair. Graying of hair which happens what? Graying of hairs which will happen in the younger age is called as Palithya, right? So in Palithya they are asking which guna. right? You know very well that pitta along with vad is the reason for graying of hair. Okay, and when pitta is there, which guna will be there? Ushna guna. And Ushna guna is having the characteristic of what? Pachana. For Pachana, what is needed? Ushna is needed. Ushma is needed, right? So that you have to always keep in mind for graying of the hair. Okay. For Palithya, the Pitta dosh along with Vada is what reason? Okay. Dominance of Pitta is there. In Pitta, the Ushna guna is there. The Ushna guna will cause Pachana of doshas in the Romakupa, and that is the reason of getting Palithya. That is the reason of what? Whitish discoloration of the scalp hairs, which is nothing but graying, premature graying. Okay, got the point. Moving on to the 10th question. The color of hair is due to the pigment dash produced by melanocytes. Okay, you know our hair is having what color. Some will be having black color hair, some will be having brown color here, some will be having dark brown color hair. Okay, when you see the western countries or what foreigners, you can see their hair will be blonde color, right? So everyone are having different what shades of hair color. So which pigment is giving the color is option A melanin, option B keratin, option C hemoglobin, option D cytochromes. So from the term melanocytes itself, you can understand which is the answer. Yes, the answer is option A melanin. Okay, so the color of the hair is produced by melanin, and we should also remember one thing: melanin is of two types, eumelanin and pheomelanin. Okay, got the point? Eumelanin and pheomelanin, there are two types. So always remember the color giving product, the pigment which is produced by the melanocytes is melanin, and melanin is of two types, eumelanin and pheomelanin. Okay, so now we completed Khalitya and Palithya MCQs. Only these questions, whether it will come? No. Just I had given you some examples of 10 questions, 10 MCQs. Okay, 10 MCQs, and I had explained those questions along with our samhitas and also the contemporary science. Okay, so in this way you have to prepare. You have to prepare MCQs from Khalitya and Palithya because it is coming under nice to know, right? Nice to know. So you have to know these things. You should be sensitized to what is Khalitya, what is Palithya, what is alopecia areata, what is alopecia totalis, what is alopecia univalis, okay, and what is Palithya, what is what a premature graying. All these things you have to know. Here I had given you 10 examples for MCQs. Okay, I had given you an idea of how to study, how to study the MCQs, and I had explained the answers as well. Okay, now we are going to the next topic, that is Shleepada. Okay, so under Shleepada, the question comes like Shilavat Padam Shleepadam, which is explained in which text? Madhukosha or Charaka Samhita? Option C is Shishuddha Samhita and option D is Ashtanga Hridaya. Okay, so what is your answer? The first, when you open Shleepada itself, this shlok comes up because this is the definition. Shilavat Padam Shleepadam. It is explained in Madhukosha. Okay. Here I had given you the shlok also down. Shilavat Padam Shleepadam Shanaihi Shanaihi Ganam Shofam Shleepadam Tat Prashakshate. Okay. Shilavat Padam Shleepadam is explained by Madhukosha, and Shanaihi Shanaihi Ganam Shofam Shleepadam is explained by Ashtanga Hridaya Uttarasthana 29th chapter. Okay. So what is Shilavat? What is Shleepadam? Have you seen the patient? What is it? Is filariasis, right? So you will see the what leg portion will be totally swelled up like the elephant foot, right? It will be very hard like a stone. What is Shila? stone. Shilavat is stone. It will be hard. Shilavat padam. Your feet will be like a stone. Yes, Shleepadam. It is this condition where the foot of the individual gradually becomes swollen and hard like a stone. Shanaihi, Shanaihi, very gradually. Ganam Shofam. It is going to what? Heavy and swollen. Shleepadam Tat Prajakshate. This is how the Shleepada gets manifested. Okay. So you have to remember Shilavat Padam Shleepadam is explained by Madhukosha, which is nothing but what they are telling. The leg portion will be gradually increasing in size in Ganatvam and also Shofam, and it will forms like a stone, forms like a Shilavata. Okay, got the point. Next, second question. In every Shleepada, there is dominance of dash dosha. Option A is Vada, option B is Pitta, option C is Kapha, and option D is Tridoshaja. Okay. So Shleepada, Shleepada disease, there is predominance of which dosha? Which dosha predominance is there? Shleepada is a Kapha Pradhana Tridoshaja Vikara. Kapha Pradhana. So here they had asked predominance, right? So predominance is Kapha. Okay. So in Shishruta Sthana, Nidana Sthanam 12 chapter 13 shloka. It is given. What it is given? Janye Shleepadani Kafoduchrat Gurutvam cha Mahatvam cha Yasmanasti Vina Kafat. Right? Kafa, Kafo. They had given what? Yasminasti Vina Kafat. There is predominance of Kafa in every types of Shleepada. Okay. And they says that Shleepada won't occur without the involvement of Kafa. Okay, Shleepadani, Kafo Ushrat. Okay, Kapha is the predominant dosha in Shleepada. And the last line that says that Yasmana Asti Vina Kafata. The Shleepada, there are three types. In those three types, without Kapha, Kapha is going to be the predominant. It is Kapha Pradhana Tridoshaja Vikara. So without Kapha, the involvement of Shleepada is not there is the answer. Okay. Moving on to the 13th question. Okay. Purana Udaka Bhuyishtaha Sarva Ritushu Cha Shitalaha in Shleepada is explained by option A Charaka, option B Shushrada, option C Madhavakara, option D Ashtanga. So who explained this? This comes under the Nidana of Shleepada. So who said is? It is said by Shushrada. So here comes the shlok. I had given you the shlok also. It comes under Shushrada Nidana Sthanam, 12th chapter, 14 shloka. Purana Udaka Bhuyishtaha Sarva Ritu Chashitalaha Ye Deshas Deshu Jayante Shleepadani Visheshataha. Purana Udaka Bhuyishtaha means water. Where there is excess of water accumulated. Okay. Contaminated water. Sarva Ritushu, all the Ritu, it will remain cold. Sarva Ritucha Shitalaha, all the Ritus, it will be cold. Like Ooty, Kodaikanal, all hill stations, throughout the year, it is going to be cool, right? Cold, right? So, this line, this phrase is told by Shushradacharya, Nidanasthanam, Shushruda Samhita, Nidanasthanam, 12th chapter, 14 shloka. Okay, so the persons who are going to reside in Sarva Ritucha Shitalaha, that is a place which is going to be cold in all the Ritus, and also where there is contaminated waters in slum areas. Okay, where the drainage is not proper, where the people are residing beside the contaminated water. Purana Udaka Bhuyishtaha. Purana Udaka, that is old, bad water, contaminated water. Water is actually said to be in flowing nature, right? Right. In river, sea, and all, the water is moving, right? It should not stay, it should not get stagnated, right? So when there is there, it is the major reason for the Shleepada disease, major positive factor for Shleepada disease. It is said by, you should not forget, it is said by Shishrada. Okay. Moving on to the next question. Dushti of Asrik and Mamsa in Shleepada is denoted by option A Charaka, option B Ashtanga Hridaya, option C Shushruta, and option D none of these. So you know very well, I had told you Shleepada is caused by Kapha Pradhana. Kapha Pradhana Trijoshaja is Shleepada. But one Acharya had told there is Dushti of Asrik and Mamsa. So who said this? It is said by Ashtanga Hridaya. Okay. In Ashtanga Hridaya it is said. You know very well that Vata Pitta Sleshmano. Okay. That also Sleshma Pradhana Tridoshaja is said in Shushruta Nidhanasthana. Down I had given the Samprapti. But this extra point, this is the important MCQ question you should all note. The Dushti of Asrita and Mamsa in Shleepada. This term Asrita and Mamsa Dushti in Shleepada is said by Ashtanga Hridaya. Okay, that you have to keep in mind. Okay. Moving on to the next question. The feature in Shleepada. Khandaha Eke Rupachitam is the feature of option A Badaja Shleepadam, B Pittaja Shleepadam, option C Kafaja Shleepadam, and option D all of these. Which will be the answer? What is Kantaka? Thorn like projections. Where it will be seen? Which Shleepadam? It is Kafaja Shleepadam. Okay, so here I had given you the shlok also. Sleshmajam tu Shvetam. Okay. Snigdhavabhasam mandavedanam barikam mahagraditam kante rekarupachitam cha. Okay, so in Sleshmaja Shleepadam, the color will be, okay, the color of that skin will be white in color. Okay, it will be Snigdhavabhasam. If you see, you can see a glariness, oiliness. Snigdhatvam you can feel. The person will be having a very mild pain. Barikam, it will be very heavy. The person will feel very heavy. Mahagraditam. Okay, Mahagraditam, it will be what? Huge swelling and graditam will be there. Kante Rekarupachitam means what? Thorny elevations will be there. Okay, so thorny elevations. Then this barikam. Okay, then Mahagraditam. All these are symptoms of kapha. Okay, so Kantereka Upachitam is the feature in which Shleepadam is Kafaja Shleepadam. Okay, I had given you the shlok also for reference. So it is Kafaja Shleepadam. Moving on to the next, Shleepada is incurable if it occurs in Kapha Prakriti person due to Kapha Vardaka Nidana is explained by which Acharya. So you know very well, if there is homogeneity, for example, if it is a Vada Prakriti person, taking too much of Vada Vartaka Nidanas, okay, the person is going to be more prone to Vadaja Vikaras, right? That is what we studied. The same with all the Prakritis and Doshas. The homogeneity will cause incurability, right? The same thing in Shleepada also, it is a Kapha Pradhana Trijoshaja Vikara. So if a Kapha Prakriti person is taking too much of Kapha Vardaka Nidana and the person is getting Kafaja Shleepada, it is incurable, right? So it is said by the Acharya Madhavanidana. Madhavanidana. It is the textbook Madhavanidana, it is mentioned. It is incurable if it occurs in a Kapha Prakriti person due to Kapha Vardaka Nidana associated with profuse discharge, huge swelling, increased itching, and all the symptoms because of the homogeneity, right? In the basic itself, first itself, you might have studied that. If there is homogeneity between the Prakriti and Nidan, the disease is very difficult to cure, right? It will become asadhya. That is what they had also explained here. And moving on to the 17th question, okay. If the condition Shleepada is having chronicity of more than a year, very big swelling like ant hill, along with discharge, what is the prognosis? What is the prognosis? So, it is a very I have also seen many patients with Shleepada who is having more than 10 years. It is very difficult to treat them. Okay. It will be very chronic in nature. The swelling will be big. They are telling like an ant hill. Like an ant hill, it will be big. Okay. And there will be profuse discharge, pain. So whether it is sadhya or asadhya or yapi or krichra sadhya, what is your answer? It is asadhya. Okay. So here in Shushruta Nidhanasthanam 12th chapter 12th shloka, Acharya have explained that Valmika jatam prasruti iti varjaneditu. So varjanam, you have to reject. You have to reject the patient who is having the disease more than 1 year. Okay. And those who are having a very big swelling. Okay. Ati mahatvam, which is very big, like a ant hill. Valmika is nothing but water. It is ant hill. And with discharge. Prasrudam. Discharge. We should reject. What is varjanam? We should reject. Reject means those patients are asadhya in nature. We should reject that patients. We should not take that patients for treatment. What Acharya says, when a disease is incurable, when you can't treat the patient, you should reject that patient. So under Varjanam, the Shleepadam also comes when it is having the symptoms like chronicity more than 1 year. Okay. And then Ati Mahatvam, very big like Valmikam, that is like anthill. And Prasrudam, very profuse discharge. Then we have to reject that patient. It is asadhya in nature. Got the point? Next, types of Shleepada. Already I had told you also in the while taking the lecture only I told you it is of three types. Shleepadam is of three types. Okay, three vadam vada, pitta, kapha, nimittam itihi. Okay, so three types: vadaja Shleepadam, pittaja Shleepadam, and kaphaja Shleepadam. And the ninth question is Animittaja Ruja seen in which type of Shleepadam? Option A is Vadaja Shleepadam, option B is Pittaja Shleepadam, option C is Kaphaja Shleepadam, and option D is all of these. So which type you will see Animittaja Ruja? So we know very well in Vadaja there will be pain, severe pain. Usually, I'm telling, in Pittaja, when Pitta is more, we will be having burning sensation. When Kapha is more, the person is more prone to get Kapha Pradhana disease. What will happen? There will be itching will be more, right? So here Animittaja Rujam, okay, severe pain, which is also intermittent. It will be seen, yes, you are right, it is Vadaja Shleepadam. Okay, so here I had given you the shlok also. Vadajam, Karam, Krishnam, Parusham, Nimitta, Anila Rujam, Pari, Sputati cha Bahusha. Okay, so Shushruta Nidhanasthanam 12th chapter 11th shloka, it is given. Okay, so Vadaja Shleepadam, they are telling that the person will be having Animitta Rujam, severe pain, intermittent pain will be there. Pittaja Shleepadam, burning sensation will be there. In Kaphaja Shleepadam, itching will be there and less Mandarujam will be there. That you have to remember. Okay. So in Vadaja Shleepadam, severe pain, Animittaja Rujam will be there. Pittaja Shleepadam, what? Burning sensation, Daha will be there. Kaphaja Shleepadam, what? Itching will be there. Kandu will be there along with the Mandarujam will also be there. Okay. And coming to the last question in Shleepada, dosha gati involved in the samprapti of Shleepada. What is the dosha gati involved? You know the dosha gati, right? Udvagamana, udvagati, adogadi is there, tirya gati is there, right? You have heard about it. So which gati is there in the samprapti of Shleepada? Which gati? It is adogadi, adogamanam. So here you can see Vada Pitta Shleshmano Adaha Prapannaha. Okay. Vangshana Uru Janu Janka Tishtamanaha. Right. So you know that here the Shleshma Kapha Pradhana Tridosha. What will happen? When it gets Kupita, it will move. The dosha gati here is Adaha. It will move down. Adaha Prapannaha. And then it will first settle down in the groin region and then it moves downwards towards the padam. It will also get settled in the uru, janu, janga. Okay, and kalantraha. Later only it will get settled down in the padam. Okay, and shanehi, it will develop the shofam. Okay, so we should always remember Shleepadam itself, it is Kapha Pradhana Tridosha. Okay, and it is of three types: Vadaja Shleepadam, Pittaja Shleepadam, and Kaphaja Shleepadam. And here what is happening? The doshas first will move down. Adaha Gamanam. The dosha gati will be Adaha. And then it will get settled. First it will goes to the groin region. And from there it will goes to the what Uru, Janu, Janka, everywhere. And then Kalantarayena Padam Ashriteha. Then later by it will get settled down in the Padam. And Shanehi, very gradually it will produce the Shofam and Ganatvam. Got the point? So here the Doshagati involved is Ado Gamanam. Now we will go to the third topic. So Khalitya Palithya we complete, Shleepadam we completed, and the last one which we are going to complete is what? Tuberculosis. So tuberculosis you can expect for 5 marks for MCQs, and also you should be aware of the practical knowledge like what is the investigation and clinical examination of tuberculosis. You should be known in practically also. Okay, so now I will be dealing with the MCQs and I will give a short note on tuberculosis for your 5 marks. Okay, so coming to the first question in tuberculosis. Tuberculosis is an infectious disease caused by which mycobacterium? Mycobacterium tuberculosis, Mycobacterium leprae, Mycobacterium avium, Mycobacterium abscessus. So from the word, the disease itself is tuberculosis, and from the word you can understand Mycobacterium tuberculosis is the right answer, right? So here you can see Mycobacterium tuberculosis, Mycobacterium africanum, Mycobacterium microti, Mycobacterium bovis. So these are all the tuberculosis species. Among these, the major causative factor, major tuberculosis species which causes the Mycobacterium tuberculosis. Okay, got the point. So Mycobacterium, you should not forget at any cost, Mycobacterium tuberculosis is going to cause you the tuberculosis disease. Next question, Mycobacterium tuberculosis remains in the body in inactive state is called as option A, latent TB, option B, active TB, option C, both types, option D, none of these. So which is the answer? Excuse me. So which is the answer? It will stay in the body in inactive stage. It won't spread the mycobacterium to the bacterial infection to the others. Okay, it won't spread. And it won't cause a symptom in the patient also. So which one is the answer? From the word you can understand latent. Latent is what? Nothing but the Lena dosha. You had studied about Lena dosha, right? Lena dosha is nothing but which it will stay in the body in inactive stage. And when the proper kala comes up, okay, when it is exposed to the proper kala and bala, it will manifest as the disease with symptoms. Am I right? The same like this. Here also, this Mycobacterium tuberculosis will be present. Tuberculosis will be present in the body. Okay, and then it won't spread to others. It won't cause symptoms, but it will stay in inactive stage. It is called as latent TB. It is called as latent TB. So there are two types: latent TB and active TB. Latent TB, they won't cause any symptoms. They are not contagious. Just they will remain in the body. Active TB, they are what? Very active. They will cause the symptoms. They will spread to others. It is contagious. Okay. So these two types of TB you should remember. Moving on to the next, which type of mode of transmission is seen in tuberculosis? Whether it is airborne or droplet, or whether it is skin to skin contact, you will get what mode of, because it is a contagious disease, right? And option C is vector transmission. What is vector? Like mosquitoes or through any animals. Okay. Or option D is hydrogenic transmission. That is through any medical procedures, surgical procedures or medical procedures. How it is transmitted? The mode of transmission is, yes, option A. That is airborne droplet transmission. Okay. So when the patient is coughing or sneezing or laughing or anything, okay, around a 1.5 meter distance only, it is transmitted because it is airborne, and it is also droplet. There are two types here only. Airborne transmission is also there. Droplet transmission is also there. Okay, it is airborne droplet transmission. Got the point? So it is, remember, tuberculosis is airborne droplet transmission. Okay. And next is the 24th, which is the vaccine given to prevent tuberculosis. Which is the vaccine given? BCG, option B PCV, option C OPV, option D DPT. So which is given? The answer is the A, that is BCG, Bacillus calmette-guerin vaccine. Okay. So normally we will all everyone will be having this vaccine soon after birth. Soon after birth, the first vaccine given to the kid, child, or the infant is the BCG. Then again we will be taking the dose in the 6th week, 10th week, 14th week, and also a booster dose we will take around 15th to 18th week. Okay, so this BCG is nothing but the water, the inactive form of the bacillus. Okay, which is given because the newborns are very prone to get TB because of their less immune, right? So this vaccine is given. Okay, in the previous, now and all, it is not causing any that much scar in the place where the injection is given. But if you see the older people in the arm region, we can see the scar of the injection. Though they are getting older, we can see it is nothing but the BCG vaccine which is given soon after the birth. Okay, so always you should remember the vaccine which is given for tuberculosis is nothing but the BCG vaccine. BCG is nothing but Bacillus calmette-guerin vaccine. Okay, next. The person who discovered Mycobacterium tuberculosis was who founded that there is a bacterium called Mycobacterium bacillus. It is nothing but option A is Louis Pasteur, option B Robert Koch, option C Edward Jenner, option D none of these. So who invented? Option B Robert Koch. So this also you have to remember. Always remember Robert Koch. Okay, he only discovered the Mycobacterium tuberculosis. Coming to the next question, a combination of medication which are applied to treat to tuberculosis is to generate better response, to decrease the resistance of entity to the treatment. Option C, both A and B. Option D, none of these. So we always know there is a combination of medicine which is given to tuberculosis. Not only one dose or one combination is given. There are four combinations given, like isoniazid, rifampin, pyrazimab, and ethambutol. These four drugs are given in combination. Okay. So why combination of medicine is given in tuberculosis is to generate a better response, give a better response, to shorten the treatment time. Okay. and also to decrease the resistance. Because we know very well that one medicine may get resistant to the bacterium and it will stop reacting. So what will happen? The person will get only less improvement from the disease. Okay, it will take a long time for curability of the disease. So to decrease the resistance, we are giving combination of medicines. Okay, and also it helps in reducing the relapse of the disease, and also it helps the person to get quickly recovered in a short span. Okay, so combination of medicine, 4 medicines in combination are given in tuberculosis. Okay, so the reasons are for better response in a quick time, in a quick span of time. Second, the reason is to reduce the chance of relapse. The third reason is to reduce the resistance of the treatment, because 1 or 2 medicines may get resistant to that bacterium. So we are giving combination so that if one medicine is not working, the other will at least help to reduce the symptoms. It will destroy the bacteria. Okay, got the point. Coming to the next question, the causative of tuberculosis produces tuberculin. It is an enzyme, or it is a hormone, or it is an endotoxin, or it is an exotoxin. So it is the tuberculosis is caused by Mycobacterium tuberculosis, right? And that produces a compound called tuberculin. So they are asking, what is it? So we know that it is not a hormone, it is not an enzyme. So whether it is a endotoxin or it is exotoxin. So the answer is it is a endotoxin. So you have to understand what is endotoxin and what is exotoxin. So exotoxin is nothing but the protein which is produced inside the pathogenic bacteria. And endotoxin is nothing but the toxic material which is produced outside the membrane of the bacteria. Okay, so you should remember in tuberculosis, in Mycobacterium tuberculosis, okay, tuberculi, the tuberculin is endotoxin, that is, this tuberculin substance is present in the outer membrane of the bacteria. Okay, so it is present in the outer membrane of the bacteria. That you have to remember. 1 minute. One minute, I will connect it now. So you have to remember, exotoxin is the protein produced inside the bacteria, and endotoxin is the protein substance, toxic substance which is produced in the outer membrane of the bacteria. So here the answer is the endotoxin. Tuberculin is present in the outer membrane of the bacteria. Okay, next. The question is, this is the main symptom of tuberculosis. What is the symptom of tuberculosis? You know it affects the lungs. In lungs, what it forms, whether it is a liquid formation or tubercle formation or both A and B or none of these, what is going to form? The answer is it forms tubercle formation. Okay, so it is caused by Mycobacterium tuberculosis and it forms tubercles, that is round nodules in the lungs. Granulomas in the lungs it will form. That is the major primitive symptom of tuberculosis. Tubercle formation in the lungs is the major symptom which is seen in tuberculosis. Okay. Next question. Tuberculosis can be separated into how many categories of progression? Okay. So answer is 1 or 2 or 3 or 4. How many stages of progression does it take? They are asking. It takes total 3. First is the exposure. First is the patient is getting exposed to the Mycobacterium tuberculosis. The second is that bacterium will be in the latent phase. You know what is latent TB? The bacteria will be inside the body. Okay, it will be in inactive stage. It won't be contagious. It won't be causing any symptoms to the patient. Okay, and next is the active phase, where what will happen in the active phase? The patient will be having symptoms. The patient will be contagious. That is the third phase. Got the point? Next, coming to the 30th question, online class. Coming to the 30th question, World Health Organization recommended a controlled strategy for TB known as option A is DOTS, option B is gene therapy, option C is morphine, option D is MCT. So, which is the right answer? Have you heard about this? World Health Organization has recommended a controlled strategy for TB. It is nothing but DOTS. Okay, so DOTS means directly observed therapy. Okay, directly observed therapy. So what they will do is, usually what they will do is, a healthcare worker will be allotted. Okay, allotted for the patients. For each patient, one healthcare worker will be allotted. What they will observe is whether the patient is taking proper medicine, proper dose every day. Okay, because of every day whether the patient is taken, they will observe and they will note it, so that the patient won't miss any dose, so that the patient can relieve from the disease very quickly, so that the patient won't be spreading the disease to the other people, so that the relapse of the disease will be reduced. Okay, so for these, the government, the World Health Organization has found the control strategy, that is DOTS, that is directly observed therapy. Now, e-DOTS is also available. Okay, that is nothing but through the mobiles. Okay, through mobile phones or smartphones or tab or laptops, we can be in contact with the healthcare workers, and we can note, we can give them the information that you have taken the dose at which time. Okay, and whether you have taken all the medicines, that information you can feed in the mobile itself. Okay, so e-dot, electronic dot is also available now. Got the point? So now we had completed all the MCQs, because our topic of these three topics, Palithya, tuberculosis and Shleepada, we are going to get MCQ questions. Okay, so I had given you 30 questions, MCQ questions from these three topics. Okay, so it doesn't mean that these, I had given you examples. Okay, examples like you will get questions like this, and I have explained also. Now I will give you a short summary for tuberculosis, because tuberculosis topic you can get for what, 5 marks also. In 5 marks also tuberculosis topic is mentioned, and it also comes under DK, desirable to know. So coming to the topic definition, you know very well, it is an infectious disease caused by Mycobacterium tuberculosis, and you know very well it is going to affect your lungs, and it is going to form the tubercle formation, that is the granulomas, right? And coming to the risk factors of TB, mostly the persons who are having a malnutrition, or very extreme aged persons, whose immunity is very low, who is having diabetes mellitus, who is having AIDS, okay, who is more prone, healthcare workers, okay, and who is contact with the active TB patients, they are more susceptible to get the what TB, and who are immunosuppressive. Okay, like cancer patients, they are all very more prone to get risk. They are at risk to get. And next, coming to the pathophysiology, you know that what will happen? The person will inhale the Mycobacterium bacilli, so it will directly go into the alveoli, and there it will starts to multiply. Okay, and multiply, and then what will happen? What will happen? The immune system will automatically respond. Our immune system is already what? It will be aware if any new antigen is coming into the body. So what it will do? It will produce the phagocytes will start to engulf the bacteria. Okay. So what will happen? It will, but the bacteria starts to multiply, and then it will spread in the normal tissues also. Okay, and then what will happen is it will starts to produce the phagocytes. Will the accumulation of the exudate in the alveoli will starts to produce granulomas in the lung region. Okay, so first is the entry into the macrophages. It will entry into the macrophage. Macrophage, what it will do? It will tries to destroy the antigen. Okay, and second phase is the replication in the macrophage. In the macrophage only, it will starts to multiply. The bacillus will starts to multiply. Okay, and the third stage is what the macrophages will die because it will multiply intracellularly. Okay, so what will happen and are released when the macrophages will die. So now what will happen is these bacilli will spread to the lymphatic channels and blood streams, and it will also all over the body it will spread. Okay, through the all the tissues, all the organs and blood streams it will spread. Okay, then what will happen is the granulomas will start to produce because the macrophages will this activation will starts to kill the bacteria. Okay, it will starts to kill the bacteria. So what will happen is in addition to stimulating the macrophages to kill mycobacterium, the T cell response will form granulomas and necrosis. That's why you are getting in the lung granulomas. It is the action of the what? Development of the cell mediated immunity. Our body will try. The macrophages will try. First, the inhalation will take place. It will go into the alveoli of the lungs. So, our body will know some antigen had come. So, what it will do? The macrophages will engulf the bacteria. Inside the macrophage, the replication of the multiplication of the bacteria will take place. Okay, and when the macrophage die, what will happen? The the multiplication of the bacteria will be released. So this bacteria will move all over the body through the bloodstream to all the tissues and organs. Okay, then what happens? Then after 3 weeks after exposure, the T cell mediated macrophage activation and killing of bacteria occurs in the third stage. Okay, so due to the T cell response, what will happen? Granulomas and necrosis will take place in the lungs. Okay, so this is the pathophysiology of tuberculosis. So coming to the signs and symptoms, the symptoms like coughing of blood. Severe cough, long-term cough is the major symptom the person will complain. Fever will be there, chest pain because of repetitive coughing. Chest pain will be there, weight loss, severe weight loss will be there. Unexplained severe weight loss will be there. Chills will be there, no appetite. Appetite will not be there. Fatigueness and night sweats will be there. Okay, so when a person is having a severe cough with chest pain, fever, and weight loss, we can suspect for tuberculosis. So you know very well about Mantox test. Okay, so Mantox test, what they will do is they will inject tuberculin inside the skin. Okay, and what they will do is the next day they will measure. Okay, if it is less than 15 mm, they will there will be a what red rashes bumps which is seen in the second picture you can see. So if it is less than 15 mm, then it is negative. But if it is greater than 15 mm, then it indicate that there is chances of tuberculosis, mycobacterium tuberculosis in the body of the patient, so that we can prescribe for X-ray. Okay, so you have to remember the test investigation which is done for tuberculosis is Mantox test, and then X-ray and CT is also advised. So this is the chest X-ray. Have you can see in the second picture. First is the normal healthy patient X-ray, and second is the patient with tuberculosis. You can also see the affected area. I think you can see well. You can see the consolidation, you can see the granulomas, you can see the necrosis due to the cell mediated T cell. Complications like meningitis, spinal pain, okay, joint damage, damage to liver and kidney, heart disorders, everything will happen due to the severity of the Mycobacterium tuberculosis. Okay. So by this, I'm going to end my session. So today I had explained you about the topics like Khalitya, Palithya, Shleepada, and tuberculosis. So Khalitya, Palithya, and Shleepada, you prepare for MCQs. I have showed you 10, like a 10 from Palithya and Khalitya, and 10 questions MCQs I had given from Shleepada. So I had given you some examples. With that examples, you try to study the remaining also, because it comes in nice to know topic. So you should be sensitized with these topics. Okay. So I had given you examples, 20 MCQs I had given in those topics. The next topic, the last topic is tuberculosis. In tuberculosis, you will get MCQs and also 5 mark questions. It comes under DK, that is desirable to know, and also it comes under practical knowledge also. Because investigation and clinical examination, you should be sensitized in tuberculosis also. Okay, so I had given you 10 MCQs for examples, for understanding how, for to know how to prepare MCQs and study which are the questions you have to. So I had given you examples of 10 questions, and I had explained you about what is the definition, what is the causative factor, okay, what is the major pathophysiology, the symptoms, samanya, that is the common symptoms, the complications, what is the investigations which are done. So with this ideology, you can write your 5 mark questions as well. Okay, so I hope this session is useful for you. So all the very best for your exam. So prepare according to the new syllabus and also the blueprint which is given. Okay, and understand and study. Get sensitized with all the topics. Okay, and which topics which is meant for 5 marks and 10 marks, study in detail. Remaining topics, get you know about all the what contemporary and also Ayurveda terms, and be prepared for the exam. So all the best from my side. Thank you.
Thank you, ma'am. It was a very useful session. All these MCQs will definitely help us. Team Panchajane would like to extend thank you to you, ma'am. Thank you, ma'am.
Thank you so much. Thank you for inviting me and providing this opportunity. From myself and also from Parul Institute of Ayurveda and Research, I like to convey my heartfelt thanks to you and your team. Thank you so much.
Thank you, ma'am.